We're going to look at making garments for the upper limb, so we're looking at the whole arm and the hand, and you'll see I've used the measurement form for the upper limb, and we will actually work initially on the hand. So this is the hand measurement form, and although it shows you what we'd be looking for, it says don't write the measurements on that side. Turn the page over leaf and take the tracing of the hand. Now I've already done the tracing, but as you can see this is my hand, and then measured across the hand in each of those places required, which is shown on the front of the form, and then actually done the calculations on the hand as well. So having a closer look, you'll see that it's a 10% reduction, so it's times 0.45, and we draw a baseline which would be the fold of the fabric, and it's drawn generally across the thumb, but just 4 millimeters out from the edge of the index finger. That allows for the fabric. Now we want the middle finger to be in line with the arm, so rearrange the paper under the patient's hand so that you can have all the fingers actually on the straight grain of the fabric, and then you'll have the gussets in between the fingers. But as it is, we're looking at the width of the gusset in half, which will be about 4 millimeters, you see, because the gusset's cut at about 1 centimeter, and in half you would get the 5 millimeters, of which some of it is stitching, and it's an angled gusset as it would make best contact with the web space to run up the angle, and then it makes for the amount of fabric between each finger, because we're only looking at the profile of the hand when we trace it, and the fabric goes around the palm, but between each finger you've just got a slice, and to allow for the amount of fabric needed in the fingers you use the gusset. Now on the index finger you haven't got a gusset on the side, so you'd actually have that 4 millimeters allowed when you draw that first line, and then you're looking at a tube, doing the calculations, 10%, so it's times 0.9 divided by 2, your circumference would be multiplied by 0.45. So just showing that 20 centimeter around the palm becomes 9. It's half of the palm, which is 10, and then 10% off, so it's 9. And the same applies to each of the measurements down the sleeve or the arm, and that area at the wrist and onto the arm is a vital cuff for the edge of the glove to anchor on. You always need at least that much, and there you see is the tube that you're going to be using, and each finger then becomes a tube, and so does the thumb. Those are the vital measurements to make the tube. The widths of the wrist and the first cuff on the arm, and using a very basic grid of the calculations, you can make this yourself, going up in half a centimetre at a time and calculating the 10%, the 15% and the 20% in halves, because at times, although we would normally just put a 10% on the hand, on the wrist and the tube, you may need to squeeze those fingers a bit more because they may be swollen from the extremity, and so that 6.8 index finger would be 3.1, and the 6.6 would be 2.9 required for the full circumference of it, and the 6th centimeter ring finger would be 2.7, and the 5.5 little finger would be 2.5, but bearing in mind that you're just slashing down to that web space, you need to know quite where you're slashing. So we'll look at the tube first, which is what I always recommend. So you're starting from the fold of the fabric and working out, and although it's normally at a right angle, with the MCP line we do a slight angle across because the hand does slope away for the fingers. And then again at the wrist you would do it at right angles to the fold, so that you've got adequate width, because generally if you talk about a diagonal you're going to get slightly less than you expect in width when you're looking at it in the cross section. But here we are, so don't ever do a very sloping MCP, and certainly the others you just link up as you would with a graph those points, and you can see that the arm is that much wider than the profile because it's that much higher, and the fabric required is wider than the tracing. Now that palm measurement, the one across the metacarpal flange, is vital to get what you are able to divide between those fingers. Now that 6.8, we already have an allowance on that edge, as we said, for the height of the index finger on the one side, but on the other side you're going to take half of the gusset, because that calculation is in half of the width. So you're taking off 0.4 of a centimetre to allow for what you're adding on as a gusset. But even so, that index finger does look very wide, but putting a little marker to see where that web space would be and working on the next finger, and sometimes you have to recalculate these if it's not going to fit. But I'm realizing here that we need 2 gussets, so instead of just 0.4 taken off, you're taking off 0.8 of that 3 centimetres, which is only half the circumference, remember. The circumference is really 6.6, I think it was. But that means that in the same height as that web space is plotted, which we've traced very carefully with the pen upright in vertical position, we're now finding that the next place for the little finger, using the calculations with a gusset on each side taken away from 0.8 from 2.7. Now, have you got enough room for the little finger, which is 2.5 with only 1 gusset? The other side is a seam. So you're only taking off 0.4 on the little finger, like the index finger, just a gusset on one side. So you're left with 2.1 from that mark, and lo and behold, it's going to fit. That little finger, give it a little bit more, let it come up smoothly, because that little finger is often pinched slightly by the fact that it's a seam on the edge and not another gusset, and therefore it may use up a little bit more room with that zigzagging of the seam. Now the length of the finger is usually best to just the edge of the nail bed. You don't use a ruler to draw your fingers because they're not going to go straight up from that web. They do taper naturally as they go up the finger, so give it a slight tapering curve. Proportion your fingers, they're not quite where the trace would be because the width of the hand is allowing for a greater height, and then each finger has to fit in. But you'll notice how I have needed those calculations to find the exact point for the web spaces. If I were to just use the trace, they would be really pinched, and at times various parts of the hand are more swollen than others, and if you're measuring with the hand off the paper, it will be too tight and will close the hand up. But also we're saying that we want to put the thumb right through the center of the fabric, well, not the center, the palm side, but just a hole, and just the circumference of the thumb joint is what we're using here to calculate just how far it goes. But you see, the hole would be where that web space is sighted, and it's very important to get that thumb out at that 45-degree angle so that it has room to move and isn't traced up close, otherwise you can't see just where the web needs to be. So it's very important. If the hand were cupped and unable to lie flat, you would need to trace the other hand, the hand that is not so flexed. But here we are just checking that thumb is usually, as we saw noted on the instructions on the measuring form, it should be about a 45-degree angle, and that now determines where the fold will be on that pattern piece. It's going to be a separate piece for the thumb, a tube, and that will be the top by the thumb, and that will be where it joins onto the hand tube of the fabric, and it will become a tube of its own, so the two tubes join together. Now this is the style that we call the inset thumb, and you'll notice here this is the fact that the back of the hand has the slash. So although we have the web space where we've plotted it, the web space on the little finger needs to actually turn inwards, otherwise although there's a crease turning out, it will cut the finger down a bit too tight if it turns outwards. So that is what your pattern will look like for the inset thumb style. And you'll take the tracing paper, and you'll notice I've now got a lighter coloured tracing paper. It's easier to see through, but it only comes in this case in smaller pieces. That's why I use the very big darker tracing paper when I'm doing the legs and vests. But here we are drawing quite smoothly the fingers and taking sort of a natural curve, never using a ruler to match up the dots. It's a natural graph, and marking that this is the back of the hand, that we'd slash only the upper side of this piece of fabric, which is on the fold, and the marking in the hole for the thumb is on the underside, on the palm. So you're using one layer of paper which is transparent, but you're having to have this concept. Now I'm just checking how long I actually need this zip. I need the zip to open up and run it along the centre of the hand, which is usually in line with the middle finger. Otherwise you might find it's too close to the base of the thumb or too close to the edge of the hand, and you'd want it to go above the thumb, but it's usually best on the palm side, so it runs down the valley of the palm with the zip, because the zip doesn't allow for stretch. It actually restricts the fabric from stretching a bit. But you'll notice how when I've traced the hand, I've tried to keep the fabric or the fingers straight so that the fabric will be straight. When we cut the pattern, we don't want to have the fingers splayed. And we'll say that it's a volar zip because there'll always be a bagginess on the palm, but there's usually a tightness on the dorsum of the hand when the hand's in use. And a zip that restricts the stretch on the dorsum can actually cut in on the thinner skin. There's less flesh on the back of your hand. Now I'm once again writing the details onto the pattern, and this is a left, and it's the fabric, and it's the name that we keep giving the patient with the date, so that it will marry up whatever you're doing with the time that the measurements were correct. And you'll notice that that is just a single piece of tracing paper which we're going to cut out. You'll notice I've done a little mark on the index finger to show that it does need to be tapered, because although it's on the fold, it also needs to narrow on both sides towards the tip, because the finger does slim down towards the ends. So the gussets will also need to narrow, even though you're placing a gusset which is going to be a centimetre wide that you've allocated in the calculations. That's the centimetre wide at the base of the finger, and you'll want to taper them as they get towards the end of the finger, and also angle them so they don't stand out like a great big bell on the fingertips. Slicing both sides of the finger again to make sure it's not square at the top, not too wide at the top. You taper it on both sides. Now we're going to trace the thumb pattern. Although we've drawn them onto the same piece of paper, they will be separate pattern pieces, and that will be the fold with the seam running down the inside of the thumb, and the fold along the back of the thumb where the joints would bend and flex. Now, once again, making sure that this piece of the pattern would be married up with the other if they happen to be found separated, and would all go into the pattern package. And just showing that this, although it's a single piece of pattern, is cut on the fold in the straight grain direction with the stretch going across the width, and the thumb is being cut out. I usually cut the thumb out of scraps, but you need to know which way the grain of the scrap is going. in order to make sure that you get the right tension in the thumb. So we might as well cut the entire glove out. They don't go to waste, and that there are many times someone needing a glove in a hurry. I'll make sure that I take the measurements very carefully, calculate the pattern, draw it on, see what size the patient would need, and then if I have some stock gloves, match it up against that to be sure that I wouldn't be trying to put something on a patient that wasn't the right size and fit. It's very important, of course, that the web spaces would be in the right place and the thumb would be in the right distance from the fingers, as each hand is in its own proportion. But there is a similarity between hands that you can find to have some spare gloves of various stock sizes very helpful. Now, we always turn the slippery side out. The shiny side of the fabric is out. So making sure that I'm marking on the underside, the palm side. I've done the 3 dots for the thumb, and that will be the hole for the thumb. I'm reminding myself that it will have the zip down the volar side and that there'll be a hem. I'll generally put a hem on a garment so that the fabric responds to washing in a uniform way. If I add something on like a knit elastic, it can wash differently. Now I'm just slashing, as you can see, the top of the hand for where the point and the angle of the gusset will run down the top of the web spaces. I don't usually cut the thumb out until it's sewn on, but just showing that that's how it would be cut out. And you see it would sew on first on a flat seam and then cut away the 2 sides, and once it's cut away and loose, I would then sew the V of the thumb and then close up the finger. So sewing on either side there is the first thing I would do with the glove open flat. That's the first thing in one movement, making sure that we turn the corner of that sharp hairpin bend very carefully. The second part would be to close up the V, as you see there, it's down, and then the 2 together, pinched together, becomes the closing seam of the thumb. And just showing you how it's cut away very close to the seam on the inside. Careful not to nip the thumb itself, because a nip in this elasticated fabric soon becomes a large hole and you lose the tension. Now the next thing I always do on a glove is the hem, or as we say, if there is an elastic, in the case of a flexion glove it's often a silicone elastic to make sure the glove holds on at the wrist when being pulled up over the fingers, but in this case it's a hem. So put the end on, and once that hem is on, you'll see how I'm putting the zip on with the top edges turned out at an angle so that they are held into the single seam so that they stay away from the action of the zip head and doesn't catch or tangle when you're sliding the zip head up and down. Now I cut away the fabric that's under the zip after I've sewn it. You'll notice the line is there for the center to run up the center of the zip, but I slash to one side of the zip so that underneath the fabric will always remain like a bit of lining to stop the zip head from actually touching the flesh and the skin. The gussets will be next, and I sew them on from the underside, pinned just at the point, right on the very point, as you can see, as carefully as possible, with just enough allowance for a flat seam, just overlapping enough for the width of the stitching, which is usually very little, a couple of millimeters only of that 1 centimeter used up. Now it's an advantage that the V is on a diagonal, because that diagonal gives a better bend for when fingers actually flex. Now sewing up the inner side, which is the shorter side, back to the underside of the glove on the palm side of the hand is just the length of that finger as we had it. That V runs up the back of the hand into the valley of the web space, and that's always a very fragile join that I tell the patients not to drag a glove on and pull, because that's where it can pop and ladder across. So there we are, that would be the one seam done flat onto the dorsum of the hand attaching the gusset, and then the next seam would be a pinched seam joining the top of the hand to the bottom of the hand along the gusset. So you do that on each of the gussets, and then the next process would be to join the tube together, as we call it. The side of the glove forms a tube, and you notice it's a fairly close zigzag, so that you've just got enough room for a seam, and it won't actually be a huge amount of seam allowance sitting between the fingers. Now, writing on the process after the thumb and the hem, it was the zip. It was attaching the gussets on the top of the V to the top of the hand on each, and then to attach the underside. Oh wait, no, we attach the side of the glove together, and then it will put them into the right position for the undersides to match up. It's always worth closing up the tube, and then you know what you're dealing with. And then always remembering to taper the index finger on the fold side, otherwise it doesn't taper evenly. So once again, saying that the gussets themselves, once they're stitched, will be tapered. Otherwise the tops of the fingers will stand out like square bells instead of hugging. And the thing is, you're having the long finger because if you're putting pressure across the hand, the fingers are prone to swelling up. And if you're very often trying to actually reduce swelling in fingers, you would need to be snug at the tips and have the pressure pushing whatever superficial fluids there are upwards through the hand. And the hem, it's vital that the hem is a bit looser so it can come through. So this is running through the process of putting the glove together, as you've seen. And there we have it, a glove with a zigzag stitch, so that a little bit of a pull doesn't actually snap the stitching, and it forms a bit of an overlocking on the edges, the seams being very small. I always say to patients, please don't pull hard, make sure you work the fingers down fully before you expect to pull the rest of the glove onto the hand. It won't come down just by pulling on the end, because it stretches in two directions, and a tight finger will attach, and you've got to get them to be right to the end of the finger. Patients will often say, I'd like to have my fingers free, but they would swell up. Now don't push it down with a pen, don't try and pull it before you've actually allowed the fabric to be available, because as it's pulled tight the fabric becomes more narrow, the fingers actually feel tighter, but pulled into the right position you'll find they are the right width. You have made the pattern correctly, I hope. And certainly we find we have a great success. Now this is actually a bit loose on me, it's coming down far too easily, but don't pull the finger down very easily, because you'll end up with the pad sticking out and swelling up. Now this glove wasn't actually the one that's been made to my size. As you can see, it is rather long, but the zip does open up to the thumb so that you can get your hand through, the widest part being where the thumb is, and then close it together. And it's making contact across the back of the hand, and yet there'll always be a bridging underneath, but fingertips are usually just a little bit available, the pads that you can use computers and iPhones for touch and also for grip, but not too much left out, otherwise they will swell up. The thumb you can usually leave a bit more available. Don't just pull it off from the bottom up. When you're taking a glove off, you ease it off each finger, and that's how you don and doff the glove. So there we have the tracing, the calculations, the pattern. And if you're trying to find a glove in a hurry and checking one that you already have, you'll find that, now you can see it's not the one that we've actually made the pattern for, it's not quite as long, but you'll see that this one would do. It doesn't fit me as well as it would if I had made the custom made one, but it is It is the right widths. I think that other one would have been longer, and that would have had the 5-inch zip, whereas this only has the 4. But this glove would do if you're having to show a patient quickly how to put a glove on, and then you'd send the custom-made one. And once again saying, if a patient's hand is difficult to measure and trace, you do need to get the distances between the web space and the thumb correct, otherwise you'd have a glove that was far too tight and they wouldn't be able to stretch their thumb out in time. Although when you first put a glove on that is the correct size on someone who is a very bent or cupped hand, it might look like there's excess fabric underneath, but that's because that fabric's needed for the hand to be able to fully extend, and it may help in fact trying to push the hand open. The other problem can be if people don't open that thumb out and they take the tracing without showing exactly where it is. Now we're going to look at the sleeve, and it can either be a full length sleeve you may need to do, or you could break it down into being various parts of the hand. You may need the glove, which we've already made, and generally you'd be better having the glove as a separate garment, so it's made to there, but then if you need the sleeve as well, the sleeve would just overlap by one section so that you don't lose any pressure. If they were only just joining, they would lose pressure in between. Now the reason you don't want one long sleeve on the glove is that as you move your arm it becomes dislodged. So the same thing will happen if it's an entirely long sleeve. It can be very difficult for the patient to put on a very long garment that's all the way down to the glove. So rather separate them if you can. You could have a short sleeve and a glove, or a longer sleeve, or even two parts of the sleeve, a lower sleeve and an upper sleeve. So here we go for the lower arm, and taking the calculations just on 0.45, which means you'll be half, and the distance of the arm goes to the elbow. Now you always be aware that the inside of your elbow, when it is flexed, becomes shorter. So there you are with the elbow extended, and I'm making the marks for every 5 centimeters. I'm quite easily 25 centimeters from the elbow crease to the wrist. But you'll notice that when I'm flexed at a 90-degree angle, I've used up quite a lot of that first measurement. So it's always worth, and if possible, if you're going to go beyond the elbow, even if you are going to the elbow, if you lay the arm down on the paper, you can see just where you are. You can see that that's the elbow, and you will need to be aware of the crease. And if you're making a lower garment with some elastic on, you would really have to stop the fabric about there in order to allow for the elastic not to be trying to ride up or in through the anterior crease. So although we've measured 25 to the elbow bone, it's less on the inner side with the fold. Now to make this garment, you'll notice that I can make it on the fold, and here I've got the 1 centimeter allowed for the hem, and then the first measurement on the wrist calculated at a 10% because it's an upper limb, and then putting my marks every 5 centimeters as I have marked on my arm and measured on the dots. It's usually the safest way to do it is to actually make the marks on the skin, and then those are going to be the circumferences through that cross section at that area. Once again, make sure you're measuring in a cross section to the bone, to the arm, and then plot your calculations at a right angle to the fold. And I'm really only going up 4 sections here. The 5th one is virtually in the elbow crease. So 1, 2, 3, 4, 5. I would, if I'm going all the way up, I would need to now go around that elbow and do the upper section of the arm, knowing that from the inner crease on the lower arm and the inner crease on the upper arm, there's a whole section of fabric that goes around the elbow. And yet when you bend your arm, it's going to fold up at that crease. So we do have to consider how to cope with this, but in the meantime I'm just going to plot a very basic long sleeve, the sort that if you were making a long sleeve vest it would just be the simple style on the fold, continuing up the upper arm now, and you'll notice we've just got the 4 sections from the elbow to the armpit, and this, you've got to be fully aware, cannot go any higher because the armpit is there. So although we usually have 5 sections on the lower arm, and whatever they are, if it's a child they're smaller distances, and if it's an adult they're larger, but it's often about 5 centimeters on an adult. Now this is making sure that we've measured and covered the entire arm right the way up to the armpit, and now we're going to have the tricky situation of whether we go up and over the shoulder at that armpit, or whether we end with an elastic just at the armpit, which again, like the elbow, you'd have to leave an allowance. Now you'd need a zip at the bottom of the sleeve because the sleeve becomes very narrow at the wrist. You'll notice that it's measuring just 17.2 centimeters. But if you look at the hand, now we're not just talking about the MCP like you're measuring for a glove, we're talking about the thumb being included, because that now measures 22 rather than 20, and that hand has to run through that tube, and it has to run through that narrow bit, but needs to be opened. Otherwise I'm forcing the hand through, which can be a very uncomfortable hand if it's injured. And I'm also damaging the tightness of the tube, which we do want to be snug around the wrist. So I'm looking for a place, I'm just showing the practicalities, where the hand that's 22 would pass through. On my arm, the point that's 22 is quite a few centimeters or inches up. Now we use inches when we're talking about zips. So if we're looking at from the wrist, to get that hand through, you'd need about 4 inches. It's easier to say 4 inches than 10 centimeters. But I think to make it a comfortable fit, you'd take it up to 5. Now what to do at the armpit? If we're talking about a sleeve adding on to a vest, you've seen how that works in the other direction with the seam in the underarm, but this is a garment with the fold on the underarm, which is a little bit more comfortable if you're doing just the sleeve, not to have the seam in the armpit. But here the seam would be running along the outer edge over the shoulder, and we'd use those diagonal measurements in the different way. They're coming up from the folded corner in the armpit, and it's going to be a tube which is going to fit onto the shoulder cap, as we sometimes call that part of the shoulder. Now to hold it on, you'd need something that attaches to the other side of the body, and a strap that passes under the other armpit. Now you'd need to measure what that would be, and it would do up in the front with the fastening there. Make sure it's not exactly equal, otherwise you'll find it's doing up in the other armpit, which is very uncomfortable. So the front strap would be short and the back strap would be a long one, which comes right the way around and attaches. So the back strap would have the loop velcro, so you're not passing the hook all the way around the body. So here we are with a typical strap. We'd have a slight angle on the ends where they attach to get the direction downwards. We'd have the fold on the upper side so it doesn't run under the armpit with the seam. Now we do say we don't want the join in the armpit, so you'd be moving that to a sensible place, possibly if you can arrange it that it's closer to central for the patient to do up, and certainly not with a join under the armpit. Now the sleeve would be with a fold, and you'd have to think about what's going to happen at the elbow when they crease. Sometimes you'd just leave the fabric and it does crease, or else we've tried various things, taking it out and putting a dart, but then you don't have the full length when you need to. The other way of doing it is to have a hem on the shorter sleeve, for instance if it were a vest, with the short sleeve, and then the sleeve that's longer being a separate piece that just goes up to overlap with the short vest sleeve on the upper arm. It goes beyond the elbow if there were injury there, and that means they can take off 3 pieces: the glove when they need to wash their hands, even the lower arm sleeve, and they're still left with the vest on, because you don't want to have to take the whole thing off when you're washing your hands. If it were a long sleeve on a vest, they'd just undo the zip and be able to wash their hands. But now this is if we were just going to make a shorter arm sleeve for the lower arm. And looking at that with just the one seam, it does mean that all the contour is on one side of the arm, and best on the outer side, so that the inside is a smooth piece of elastic and a smooth piece of fabric. But the other way of doing it to get a better contour, and I'll show you for better reason as well, is to halve those measurements again. And instead of that measurement becoming a 7.7 calculation, it becomes a 3.9. So it's the circumference times 0.45 because it's upper body, and then a half again, so that you are going to get the contour on either side. You'll have a double seam, one on each side of the arm rather than just one side of the arm. And this is what you get. You'll get a garment which has the same dimensions, but just the center of the fabric, the straight grain of the fabric running down the center. So the contour and the curve is shared across the arms, muscles and swells, rather than all being on one side. Now this gives you the advantage if you're doing that 3/4 sleeve, as I mentioned, which just goes past the elbow. You can get rid of that extra creasing. So you see we need that full length going up the back of the arm, from the wrist, going to the elbow and travelling up the arm. The advantage of having this two panelled garment is that the anterior panel can be made shorter, just by enough to stop that wrinkling in the elbow crease, and that way you just ease the fabrics together. Along the inner arm, a flat seam, but with the longer distance fabric being on the outside, and then just eased so that you get the fullness, the swell for the elbow, the extra length of the elbow, but less of the fabric on the inner arm. You do have to put the garment on with the palm upwards to make sure that you're getting the side seams either side of the anterior elbow, so that you've got the shorter panel definitely running across where the elbow creases, and you'll get far less wrinkling up of the fabric, which can be annoying, but it means that when you use your elbow you have got the distance that won't keep pulling the elbow down. The other thing, if it is still pulling the elbow down, is to put a little bit of expander elastic. We use the two-way stretch, and just as the elbow bends, it usually just allows enough so that the elastic silicone band still stays attached to the arm where you want it to hold up, and the elbow has enough room. So this style of the two-panel sleeve works very well for when you're going up across. Now here you've got the one seam lower arm sleeve and the side seam lower arm sleeve, which are both covering the same area but giving a slightly different flare. For a bulkier arm you do better with the side seam, because it can then accommodate the greater width without becoming too much of a diagonal, but making sure of course that you're ahead of the elbow crease so that you don't run into that elbow crease with the elastic. But the reason you'd need, if you're going beyond the elbow, the panelled sleeve is even more of an advantage, because you can take away that creasing at the elbow and going beyond that elbow so that you can cover an area of burn. Now here is showing another idea to cover an injury at the upper arm that needs a bit more contact than the strap would give, is to actually be attached to half a vest. It's almost like the strap idea, but it gives that bit more coverage. So these are the various ways of coping with injury on the upper arm, is to have something that's attached to the vest. And you notice this has got the seam along the top of the shoulder again, but instead of the straps, it's got a bit more contact. Now, the longer sleeve with just the straps would be giving coverage to something that is higher up the arm, but not actually on the shoulder. If you've got the entire arm damaged, you may have to have one completely long sleeve, but if someone is very damaged, it is easier for them to cope with separate garments, several separate garments. Now I'm working with the wrong side here. We've got a left arm, and the glove happens to be a right glove. But the idea is that you've got your various garments slightly overlapping so that the one doesn't pull on the other. Particularly, you can then have the zip on the dorsal side for the sleeve, and on the volar side, which is easier for the hand on the glove. And once again, you can have covered the entire arm in a variety of ways, depending on the requirements and the patient's needs. So it's either the shorter sleeve over a 3/4, or an entirely long sleeve, or a lower arm sleeve, or the half vest, depending where the injury is, that you're going to make adequate cover, and possibly multiple garments to cover each of the areas. Each area ideally covered with at least 2 inches, that's 5 centimetres, to spare either side of the injury in the garment covering without rubbing onto the injury or leaving it too close. So this is showing you the entire variety for the upper limb, whether it be the single seam short arm sleeve, the single seam long arm sleeve. This garment is not quite the same size, but the first thing would be the hem while the fabric's wide open, and then attaching the zip in the usual way with it. Once it's sewn up either side, the under piece of fabric is cut to close to one edge of the zip stitching to make a lining, and then the next thing would be the elastic, wherever it may be, usually fairly well up the arm to hold on beyond the muscle, but ahead of the elbow crease, so that the elastic, and this may have been a smaller person, as you can see it's a narrower sleeve and shorter too. People are all sorts of proportions. This is for a bulkier arm with the 2 sides where the measurements are halved and yet you're using 2 panels. And whether it's a simple one or not, you would sew the medial seam as the flat seam, so that the seam running up against the body has not got the pinched edge annoying the person as they walk, move the arm around. So that's your flat seam. It would be the first thing to make, so that you once again get back to having a complete piece of fabric, and then you do the hem, then you do the zip, and then you do the elastic at the top. And the elastic goes round in one piece, although it's 2 seams, and then you finish off with the pinched seam, and either you sew the elastic straight across like that, or sometimes you overlap it slightly, because some elastic pulls through if it's just got a very simple zigzagged edge. So that's fairly simply the sequence I would use for sewing an arm sleeve. Now, a little bit more complicated is when you're passing across the elbow and you're using the shorter top panel style or anterior panel, and you cut it out with the area at the sleeve folded for the anterior panel but not folded, so you get the full length for the lower panel. And as you get to that elbow area, you would make sure you eased the length onto the shorter anterior panel, and that your fullness is around the elbow area. And once again you'd have your zip wherever you need it. In this case it's more to the dorsum side and the anterior's free. And then again, before you've closed up, if you are going to put the expander, you'd push it in, but otherwise without the expander you purely sew it up down the side, and there you have the 3/4 anterior panel style. We found this to be a great advantage for people who need to travel beyond the elbow without the discomfort of it falling down, pulling down, or wrinkling up in the crease. And once again, if it needs to be a longer sleeve, you can either add it on as a separate piece, or even if it were a vest, that sleeve could be the entire sleeve, or it could just be the half short sleeve on the vest with the 3/4 as seen to cover the elbow and the lower arm. So in this case, once you've sewn up the hem, you'd then, while it's fully open, either attach it onto the vest or you would attach it onto the straps. I would normally put an edging, either a small hem or an elastic on that edge if it weren't going on a vest. But if it is a vest, it's just sewing up the outer side. The rest of the vest, of course, we've covered in a previous video.